Hello, I'm Mary Ann Dalton, and welcome to Active Aging, a program devoted to exploring issues of importance to older people and people living with disabilities. Each month, we'll provide you with information and resources to help you live a healthy, satisfying, and independent life. This month, we'll talk with a home care professional about how families can care for individuals with complex care needs at home. We'll also speak with a health insurance expert about options for people over age 60. Hello, I'm Mary Ann Dalton and welcome to Active Aging. My first guest today is Lois Stillman. She's a registered nurse and the Director of Client Outreach at Somerville Cambridge Elder Services. She's here to talk about individuals with complex care needs and how families can help these individuals stay at home. Lois, welcome to the program.
And thank you for having me today. It's really very exciting to be here.
Yeah, well, I know there's a common misconception in the community that, very severely disabled people, very frail elderly people, people with complex care needs need to be cared for in a nursing home. But, I've come to understand that there's a lot of options for people to remain in the community. Maybe you can talk a little bit about how things are changing.
Well, you're right. It's very exciting. There's certainly been a lot of changes, and one of those is that in 2007, it was decided that family members, sons and daughters, daughter-in-laws, granddaughters, nieces, and even close friends would become paid caregivers. And this has allowed a lot of people the opportunity to have their care needs done in a setting that they prefer. We've been very fortunate at Somerville Cambridge Elder Services. Recently, we discharged 2 people from a local nursing home. They were both ventilator dependent, or they were on machines that help them breathe at night. And years ago, if you were on this type of machine, you were probably confined to a hospital till you died. But they decided to move in with their daughters, and they are being cared for by their daughter and other family members, and their daughters and families are being paid.
Wow, that's wonderful. So this is like one of a number of cases. There's a lot of people who are this is happening too in Somerville and Cambridge.
Yes, we've been very successful, and not only people like this, but people who've had severe strokes, or younger people with chronic disabilities like MS or diabetes, people who have Alzheimer's, who have somebody that they can count on and feel comfortable with providing their care.
Well, that's interesting because often, Alzheimer's is one of those diseases people just assume that, a nursing home is the only setting for them. So that's great. Could you talk a little bit about? I know there's specific programs that are helping people to, achieve this kind of goal of bringing a family member home, adult family care, personal care attendant program choices, things like that. Can you speak a little specifically about some of the guidelines for those programs or how they work?
Well, all the programs that you mentioned. Mary Ann, a younger person or an elder has to be Mass Health eligible. And if they are, then these programs are paid for by Mass Health. The Adult Family Care Program, this program is for people who move in with their daughters or sons or a close friend, and they have to be willing to provide the care. And so that Mass Health or Medicaid will pay them up to $18,000 a year to provide that care, tax-free.
Wow, so that's a real option for people who are really struggling financially to help a sick loved one.
Well, in many cases, $18,000 a year will put food on the table and help pay the taxes in the home. So that this is a very nice option. And if if they have a daughter who is 62 years of age and wants to retire to take care of a family member, then they still can collect their Social Security and not have to pay any money back because it's tax-free money.
That's interesting. Now,
So-
how does the personal care attendant program work? I know that's similar but different.
It's similar but
Yeah.
different. Yes, you're right. With the personal care attendant program, this allows people to self-direct. And so what I mean by that, if you're 16 years of age or older, and you want to live in the community and you want to hire, train, and supervise your own workers, they will be paid $10.84 an hour by Mass Health. And what's nice about the program is that the person that you hire, because you're the employer, or if you cognitively cannot manage a program, you can have a spouse direct the program or another family member. They're allowed to give medications and do things that a home health aide from the visiting nurses are not allowed to do. So that most people that are in both of these programs, adult family care and PCA, they can hire somebody they trust. And it's really become a very, very successful program, and it's two of the fastest growing programs here in Massachusetts right now.
Oh, interesting. Are there any other options? I know, like within the home care program, there's the Choices program that also will pay for a lot of care needs.
The Choices program also is an excellent program, and that program's for somebody that is over 60 years of age. Again, they have to be on Mass Health, and they have to meet what we call nursing home eligibility. And what that means in the state is that you're required to need some assistance with perhaps getting in and out of the shower, maybe getting dressed or getting undressed, or maybe help getting up or down from a chair. And if you meet this minimum criteria and you need some assistance, this program will, because it's a fee-for-service program, will provide all the care needs and service that you need, but we send the workers instead of you hiring your own.
Oh, okay.
So, for example, recently we had a very ill patient at one of our local nursing homes, and they wanted to go home. They wanted to be in their own setting, but they required a lot of care. So we discharged them, and right now they're at home, and they're receiving a worker home health aide from 7 a.m. in the morning to 2 in the afternoon, and then the home health aide leaves, and then a new one comes at 4 p.m. and stays till 9 at night until that person goes to bed. And this is allowing them to be in their home setting.
Wow,
It's just so amazing.
Those are
And years
really-
ago, we wouldn't be able to do that.
Wow, that's an intensive service package, and that's interesting because it seems like one of the biggest barriers for people to either remain at home or return home from a nursing home is this whole idea that it's not safe at home, that somehow that it's the home is a less safe setting than either assisted living or a nursing home, but in fact that may not necessarily be true. Is that something that you find?
You're absolutely right, because if you really think about it, many of our nursing homes are not well staffed, especially on weekends. And if you have a family member that is a resident of a nursing home, do we ever see a staff member actually sitting in their room all day? No. So somebody can fall in a nursing home or they can fall at home. And not that we ever want to see anybody fall, but it can happen in either setting. The other thing is that somebody at home is less apt to get infections. And in nursing homes and in hospitals, as we know, there is a lot of, there's many chances that you will acquire an infection. So that at Somerville Cambridge Elder Services, we feel that people should have the opportunity to choose.
That's right.
To where they might want to get their care. And if they want to choose to have it at home, then we can help devise a program or a service package that will meet their needs.
Oh, that's interesting. Now, I know you also work on a program with local nursing homes where you assess some of the needs of their residents and look for ways to bring people back to the community.
Yes, right now, at all our local nursing homes, we send a registered nurse there on a weekly basis. The social workers or the discharge planners provide our nurse with a list of people that have been new residents, and the nurse will go in, introduce herself, and give them material, brochures, and information about what would be available to them when and if they're ready to go home.
Oh, wow. That's
So that way they can do some planning. And if they're unable to do such planning, then we leave the information with a card, and we're hoping that a family member will call us and say, how can we do this? And there's always somebody that's available in our information department. We can send somebody out to, we have elder care advisors that can go out. It's a free service and explain what is available in their community and in our own community here to safely bring somebody home.
Wow, well, it really does sound like there's a lot of options, and perhaps the biggest barrier is sometimes the belief that you can't do it at home when in fact you can. So if someone wanted to find out how to arrange these services, where would they call?
They would call Somerville Cambridge Elder Services, and our telephone number is area code 617-628-2601.
Great. Well, thank you for
Thank you for
joining us
having me.
today.
Yes, thanks, and thank you very much for having me. It was a pleasure.
I love the Somerville Public Library because it's a quiet place to help me study for my college exams.
I avail myself of the services of the library periodically. I like their audio books, and they also have talking books available.
I like the library because it helps me with my school projects.
I like the library because it does help me a lot when my daughter has school projects. I've been bringing my daughter since she was little for this story time.
I have been living in Somerville only since 1985, but I found the Somerville Library to be very well equipped and very up to date and very helpful.
I work full-time, and I come to the Somerville Public Library because it has convenient evening hours and all the continuing education resources I need to further my career.
We like the Somerville Public Library.
Are you looking for a meaningful way to give back to the Somerville community? Do you want to think globally and act locally? Do you crave great company, tasty food, and more than a few good laughs? If the answer is yes, consider joining the Somerville Rotary Club.
Rotary is a worldwide organization of business and professional leaders that provides humanitarian service, encourages high ethical standards in all vocations, and helps build goodwill and peace in the world. Over 1 million Rotarians in more than 200 countries respond to international needs through the Rotary International Foundation. Somerville Rotary responds to our neighborhood's needs through grants and volunteer service projects.
Last year, Somerville Rotary raised and distributed thousands of dollars to organizations serving our city.
Club members took part in projects serving youth, the homeless, community education, and the environment.
If you would like to give back to the community, the Somerville Rotary would like to hear from you.
My second guest today is Corinne Lofty. She's a licensed clinical social worker, elder care advisor, and also a Shine counselor at Somerville Cambridge Elder Services. And she's here today to talk about a special health insurance counseling program available to local residents. Welcome to the program.
Thank you, Miriam.
Yeah, so to start off, what is Shine? What does it stand for, and how does the program work?
Sure. So SHINE stands for Serving the Health Insurance Needs of Elders. A little bit of a mouthful.
Yeah.
And basically, it's a free information, counseling, and assistance program for all Massachusetts residents who have Medicare and for their caregivers.
Interesting.
And it's a network of trained volunteers, primarily volunteers, although some paid staff as well, who go through quite an extensive training on all kinds of health insurance information that is available to Medicare beneficiaries. And then after that initial training, there is ongoing monthly training as well to all the counselors. And then, throughout the state, these counselors are available to meet with, as I said, any Medicare beneficiary who has questions or, need some assistance figuring out the health insurance system, because it's a very complicated system.
Well, it sounds like a wonderful resource. We know that it is complicated, and so you're here today. We're going to pick your brain a little bit. So we're going to start at the very beginning, the basics. What is Medicare, and what does it cover?
Sure. So Medicare is a federal health insurance program. It started in 1966, and it is a program that was never meant to be comprehensive. So it doesn't cover all of someone's health care needs. It's a program that serves most people in the United States who are over 65 years old, and then some younger people who have disabilities. And so like I said, it's not comprehensive, but it is meant to provide a basic health insurance to cover the majority of retirees' health care costs.
Interesting. So it's broken down into different sections: Medicare A and B, and and what are those different parts cover?
Okay, so Part A is primarily for your hospital needs. Part B is primarily for your doctor's visits and primary care and specialists, and then Part C is a little bit confusing, but that is all of they're called Medicare Advantage plans, and those are HMOs and PPOs, and so they're kind of alternatives to basic Medicare. And then Part D is the newest part. As most people have heard about, it's D for drugs, so it covers your medications.
Oh, interesting, which is a huge problem for a lot of elderly people.
Yes.
Now, you're saying it's not comprehensive, so what are people's options to supplement their Medicare coverage?
Okay, so there's a lot of different options, and that's one of the major areas that Shine counselors help people with, because there are so many options, it's very confusing to try to figure out what the best option is for an individual. So there are something called Medigap policies, which are something you buy to supplement your Medicare, and then what I mentioned, which are the Medicare Advantage plans, which are kind of an alternative, an HMO type plan. And then there is, for some people who qualify, Mass Health as your previous, what is that called? Previous woman you had on, Lois, she spoke about Mass Health recipients. So that can also augment Medicare.
Yeah, that's interesting, because I think people do get confused between Medicare, Medicaid, which is also known as Mass Health in Massachusetts. Can you talk a little bit more about Mass Health?
Sure. So as you said, Mass Health is synonymous with Medicaid. It's the Massachusetts version of the federal. Medicaid is a federal program, and Mass Health is the program for Massachusetts residents. Mass Health is basically an income and asset eligible program. So, so in order to qualify, you have to meet certain guidelines based upon your income and your assets, and they also look at immigration status as well. So Mass Health serves a lot of different types of people at various stages of life, but we primarily work with those who are over 60. So in that sense, it's often people who have Medicare in addition to the Mass Health.
So you can have both Medicare
you certainly can, yes.
Okay, interesting.
You can have both, and so Medicare, if you do, Medicare would be your primary insurance, and then Mass Health will supplement all of those gaps that I was saying, that there's a lot of gaps that Medicare doesn't cover. So Mass Health will cover those gaps, and it will also cover a lot of additional services. Oh, wow. So again, like your previous guest Lois mentioned, there are a lot of programs like the personal care attendant program, adult family care, that that Mass Health covers, that Medicare, doesn't have any types of those kind of long-term care.
So it really opens, it sounds like Mass Health really opens up a lot of options for people,
Yes.
and that they should, if they're not sure whether they qualify, it would make sense for them to pursue that maybe with a Shine counselor, because especially if they need a lot of care needs, they have a lot of care needs, they could get them through Mass Health.
Exactly, yes. That, so yeah, people are always welcome to call, and we can even kind of do a little bit of initial screening over the phone, ask them a few questions to see if they may be eligible. And then if it looks like they might be, then we could, meet with them in person or meet with a caregiver and kind of really determine, help them to fill out an application for Mass Health, and then they would be able to see whether they do indeed qualify.
Oh, well, that sounds like a wonderful resource. Now, what are the most common kind of things that you help people with Shine?
So I would say Mass Health is definitely one of them. That's probably our most popular, helping people fill out the application and figure out, all the verifications that they might need to send along with that. The other major thing is medication costs. As you know that medications are a huge cost for a lot of older adults, and so we help people with the Medicare Part D, figuring out which plan might be the most cost effective for them. And then there are programs to help low-income elders with some of their medication costs. There's a federal program called Extra Help, and then there's a Massachusetts state program called Prescription Advantage. So we do a lot of those applications as well.
Interesting. So now, if people wanted to get some more information or more resources, are there other resources like online that are helpful? If people want to do a little research before they contacted a Shine counselor, where might they turn?
Okay, sure. There are. The websites are becoming very enhanced. Medicare, I know, has been doing a lot of enhancements on their website. So Medicare.gov is a website where you can find a lot of information, and you can go on there and you can plug in all the medications you take, and it will compare the different costs of all the plans in your area. The Social Security website also has a lot of very useful information. There's also a statewide phone number that can help you specifically. They have pharmacists on hand to help answer medication issues, and that's called Mass Medline. Where else? The state's website also has a lot of information on Mass Health. All their regulations are on there. It can be, tricky for a lot of people to navigate all these websites. So that's what we can, you don't have to go do that first. You're welcome to call us, and we can kind of help with that process. But if you'd like to, those websites are great places to turn.
So, if someone wanted to get the assistance of a Shine counselor, who would they call, and how would they set that up?
Okay, so if they live in Somerville or Cambridge, or a caregiver lives here, they should call the Somerville Cambridge Elder Services, and our number is 617-628-2601, and they would be connected to our Aging Information Department, and then we would make a Shine referral. And like I said, we can do the counseling over the phone, so they don't have to come in. It can be done over the phone, or it can be done at our office, or we can come to the home and meet with the elder or their caregiver at their home.
Wow, well, great. It sounds like a wonderful program. Thank you for joining me today.
Sure. Thank you for having me.
Thank you for watching Active Aging. Please join us next month when we'll bring you more strategies for aging well.